It's been called the flu-nami, a wave of flu cases driven by a mutated virus. Here's what you need to know. Latest NHS statistics show an average of just under 2,700 beds a day were occupied by patients in England with flu last week, enough to fill 3 big hospitals. It's a 55% rise from the week before, and the NHS says it's facing a worst-case scenario for the time of year. Most of the cases at the moment are caused by the H3N2 strain of flu. It tends to cause more severe symptoms, particularly in the elderly. There's a version of the strain in this year's vaccine, inactivated so it doesn't cause disease. There are 2 other flu strains in there too. But the decision on exactly which versions of the flu strains go into the jab is taken in the spring to give manufacturers enough time to make millions of doses in time for the Northern Hemisphere winter. The H3N2 virus evolved significantly in the summer to become subclade K. The 7 new mutations help it evade the immunity in the population that's built up from previous infections or vaccinations, so it's spreading rapidly. In a typical year, every 100 people with flu would pass the virus on to 120 others. This year, it's estimated to be 140. The mutations also mean the vaccine isn't as well matched against the virus. But the UK Health Security Agency says it's still 30 to 40% effective at preventing hospital admissions in adults. As for masks, the NHS's most senior emergency doctor says that's up to you.
I think at the moment what we're saying to everyone is to be sensible and pragmatic. So if you are symptomatic or if you are vulnerable, you may well want to wear a face mask, especially when you're out and about, and that would be a sensible thing to do.
The last epidemic in the UK was 36 years ago, when more than 1 million people were infected by Christmas. Then there were around 26,000 excess deaths. But even though current infection rates are still only classified as moderate, cases are rising steeply, just as resident doctors prepare to strike next week. The Prime Minister urged the Doctors' Union to accept a new offer.
That offer can only go forward if they don't take strike action, particularly in the run-up to Christmas, particularly when we've got a problem with flu. It would be irresponsible of BMA to push through.
This outbreak and the likely impact on the NHS could have some way to go.